Hi everybody, I am Dr. Ashutosh Kumar, intervention cardiologist cum electrophysiologist. Today I am coming here to discuss with you something which is called rhythm abnormality. In our medical terminology we say as a cardiac arrhythmias. This is the area which is very less discussed by the even cardiologist, and it is one of the area which is very technically demanding, and the issue is that the patient rhythm disorder are very transient, and sometimes it is so life threatening that patient may not reach to the hospital and they have collapsed or the sudden cardiac death has already happened and the things is closed with the patient. So cardiac arrhythmia basically means the heart rhythm is having some abnormality, and we define cardiac arrhythmia in two disorders. Either it is a tachyarrhythmias, means the heart rate is going very fast, and the other variant is bradycardia, means heart rate is going very slow. Either of the things are cardiac arrhythmias, and if the arrhythmia is leading to circulatory issues, it compromises the quality of the life of the patients. So coming first to the tachyarrhythmias. So tachyarrhythmia is the heart rate which usually in day-to-day life it fluctuates. So starting from 60 to it can go 120, 140, 150 also when you are too much exerting for a particular work. But over the time when you are taking rest or during the sleep, it can drop to 30, 40 also, and we call as a diurnal variation in the heart or with the activity. But if you are getting a rhythm or heart rate which is going above 170, 180, and which is unprovoked, means you are doing your day-to-day life and all of a sudden you started having feeling of palpitation and the heart rhythm is going 180, 200, or you are getting some giddiness, or you are getting fainting attack due to the palpitation followed by fainting attack or breathlessness, then certainly it need to be addressed and it has to be evaluated. And one thing very important regarding this cardiac tachyarrhythmias, that a lot of tachyarrhythmias in which the heart, if you are evaluating either by the echocardiography, it turn out to be totally normal, or you are doing the angiography, which usually is the first procedure whenever the patient complains as an invasive procedure, and we are getting a totally a normal coronary angiography. The important test which we have to conduct in those type of patients in which we are not having a diagnostic ECG is the EP study, electrophysiology study. And this electrophysiology study will establish, not only is going to establish the diagnosis, but it provide the information what we have to do next. And what we can say, there are some arrhythmias in which while doing the EP study we can establish the diagnosis, and in the same sitting by the same catheters we are going to ablate it. Ablate it means we are going to give the radio frequency energy at the particular culprit location and we can cure the disease. So that is called EP study, RF ablation for the cardiac arrhythmias. But there are some diseases in which the arrhythmia is going to be life-threatening, or the arrhythmia is associated with the derangement of the blood pressure, so that the vitals are coming down, the blood pressure is dropping. We call it the hemodynamically significant ventricular tachycardia episodes. In those type of scenario, we are having the treatment we call as the ICDs. We are not totally relying on the ablation, because ablation may reduce the disease burden, but it is not going to prevent the sudden cardiac death associated with the disease. So in that we are going to put the special pacemakers, and these pacemakers are having the life of 7 to 10 years depending upon the uses of battery. And that scenario, if we are going to put the device, it is not going to detect the arrhythmia, but whenever the arrhythmia is happening, tachyarrhythmia is happening, it is going to take care for that also. So it is going to give the defibrillation, what we say as the shocking, which we may have seen in a lot of moving from outside, putting the pedal and giving the shock. The same thing can device also detect as well as treat. So it is what we call a jet security for the heart, for the tachyarrhythmias, and it works like a doctor. It immediately take care, it gives the shock and bring the patient to the life. So this is the treatment regarding the tachyarrhythmias which we are having at present, and it is available in most of the cities and most of the places. You have to discuss whenever it is happening. But there are some diseases per se in which the heart rate is going down, and we call as a bradyarrhythmia. And bradyarrhythmia is due to a lot of degenerative changes. The time the patient goes in the ages, the heart rate will reduce, and there may be some what is called congenital issue with the heart beating. So in that scenario, the conduction will not be proper and the patient may be having heart rate very low to sustain his day-to-day life, and the patient will be getting this complaint of syncope, dizziness, and sometimes palpitation also. So in this type of illness, we have the ECG will be very much diagnostic if the patient is symptomatic, and that information is vital. We have to just label, yes, bradycardia is there, complete heart block is there, or the rhythm is having some issue, it is intermittently the block is happening, block not of the coroner, is block of the electrical activity. In that scenario, we have to treat, and the treatment is pacemakers. So these pacemakers are implanted below the collarbone by the minimally invasive surgery, which is done under local anesthesia. Patient has to be there for 2 to 3 days, and after that patient can be discharged, and they will be having the normal life what everybody is enjoying. They can also, the life will be as usual of the normal person what the pacemaker patient will be having. So a lot of myths are there that when one time if you put a pacemaker, then you have to be always in the doctor's corridor. It is nothing like that. You are with the implanted device, either it is ICD, pacemaker, or CRT, or other devices. These devices is taking care of your heart rhythm related activity, and when issues are coming, you will be getting some information from the doctor while discharge that whenever these complaints are there, you have to report urgently. Otherwise, you should do day-to-day activity as you are doing it. And it's something like you have bought a car, it doesn't need that you have to come every time for the checking my vehicle is working or not. Yes, there are rules. Like when we are implanting the device, we ask that at least you can come 6 monthly to 1 year in the pacemaker. And if you are putting a ICD, if you are getting shocks, if you are getting palpitation, if you are getting some complaint, you have to report, and we have to check the device, and we have to modify the treatment as well as the device parameters, and your life will be very comfortable with the device. So device is basically a procedure. Device therapy is the treatment for some of the bradyarrhythmias, most of the bradyarrhythmias, and some of the tachyarrhythmias. And these devices, what we are implanting is under local anesthesia below the collarbone, and these devices are having longevity for pacemaker starting from 7 to 15 to 20 years or so sometime, depending upon the users. And for the high-end devices like CRT and ICD, cardiac resynchronization therapy and ICDs, it lasts for 7 to 10 years. So they have changed the total paradigm of the management of the heart rhythm related issues, even the pumping related issues of the patients, and they are having the quality of life. So I will say, if you are having any rhythm related issues, we call as a cardiac arrhythmia, first diagnose whether it is bradyarrhythmia or tachyarrhythmias, and finally with your doctor, with your electrophysiologist, plan your treatment further, whether you have to go for the ablation, or you have to go for the device therapy, ICD or CRTs, or you have to put a pacemaker to come out of this acute problem or chronic problem which you are facing for the long time. With this word, I am completing this discussion regarding the cardiac arrhythmia. See you next time with some more interesting topic related to the heart. And surely you must have enjoyed. If you are having any question and queries, you can reach me with your on my below mentioned phone numbers as well as email, and you can follow me on the tutors, and you can post your questions. Certainly I will help you out whenever possible, to you and your family member, your friend, to reach to the diagnosis as much as possible, or treat the patient also. Thank you so much.